Few people in our community have not been touched by cancer. As a patient, a spouse, a friend, a parent, for them, RCCS is not just an acronym. We are a partner. We advocate for patients and help them get coverage for procedures and treatments that their original insurance wouldn't cover. We do it for an average of 87 new patients a month, and we do it with incredible efficiency. Every dollar RCCS raises provides $27 of support for families who are facing the toughest challenge of their lives. That's because RCCS understands the American healthcare system and leverages even a small donation into life-saving medical treatment through the purchase of proper health insurance. For patients in Israel, cancer can be an even greater challenge. Having cancer in Israel, in the words of one survivor, is a full-time job. Often, they travel to America for treatment, a solution that's hard on them and their families and limits what RCCS can do for them.
I look around.
My husband had a swelling on the side of his neck, and it was growing.
I went to the doctor saw right away there was something amiss.
But I didn't think it would be anything serious.
I was sort of detached, like we're talking about someone else.
And he looks at the two of us and he said in Hebrew, I'm very sorry to tell you that, it's cancer. I think I turned white.
I look around. I see trouble all around me.
לא התייחסתי לסימנים שהעידו שמשהו לא בסדר. אז כשהלכתי למרפאה שלנו פה, התקשרת אליי רופאה באמצע העבודה. ובשביל לספר לך, מאותו מחרת, עד היום הזה שאנחנו יושבים פה, זהו, לא חזרתי לעבודה, זהו, התחלתי להתמודד עם המחלה.
I turn to you.
So I felt different, which I did ignore. My husband dragged me to the doctor, and
the doctor told us, I'm really sorry to tell you, but things don't look so good. I knew Hashem is testing me. I don't know who will be the team that will help me to pass this Nisayan, but I knew there's a Nisayan coming.
Very sick patients with advanced cancer are very much frustrated from the system because they are so frightened, they don't understand what is the situation, what are the options, what is the plan.
He said there's two options. One would be surgery, and then he went in to describe to us this horrible surgery.
Maybe a hole in my mouth, maybe the neck muscles wouldn't be put together again the same way, and maybe I'd have some loss of movement.
He said then the other option was radiation with chemo. My son-in-law called the Amshin of a Rebbe. He did give my husband a bracha, and he told my son-in-law that we should call RCCS.
And RCCS, they speak with the patients, they speak with the families, they send people to the hospitals, speak with the doctors, they understand what is the plan, what are the options, and they explain deeply to the families.
פתאום מה שהבנתי שזה דורש הרבה כוחות ודורש הרבה אמצעים שלא היו לי.
I look up to the heavens and I say.
The doctor told us what the government gives is these medicines, but there's another medicine that really could save her life, give her a lot of more chances to live. I said, so go ahead. She said, but the problem is it's not covered in insurance.
These medications are not covered by the health system because there is a long gap between the approval of research and the approval of the medications to be part of the health basket, so-called.
One of my husband's talmidim approached my husband and told him about RCCS and told him to be in touch with them. They'll be amazing.
Before the RCCS came into the picture, I didn't really know what to do. I didn't know which doctor to use, I didn't know where to go.
We were scared and confused.
I didn't really think that I was entitled to any disability whatsoever.
And many people are turned down from the insurance of the government.
Rabbi Gross came to the house, filled out all the paperwork. He said, don't worry, I'll deal with Bituach Leumi. He got for us a considerable amount of money.
RCCS said the shot cost over 20,000 shekel a shot. First, we have a place, we can buy it for 14,000 shekel. And we will sponsor over 9,000 shekel out of it.
RCCS הם סנגורים של החולה, אתה מבין? זה כמו שאתה בא לבית משפט עם עורך דין. זה לא משרד ממשלתי, זה לא שאתה צריך להתבקש ולהתחנן ויקבל אותך ויקבע לך תור. אפילו אם קשה לך לבוא, יבוא אליך לבית, יבוא אליך עם האוטו, ייקח אותך אפילו לרופא, לבית חולים.
When they did surgery, they realized that the treatments failed.
That was when RCCS really came through with all the paperwork, with getting second opinions, with sending the papers to America for second opinions. And basically the treatment between the American doctors and the one over here came together.
Someone who's sick with cancer is not really in a position to worry about how he's going to survive and how he's going to provide for his family.
You're in a battlefield, and you're not thinking about anything. You're just getting through every hurdle.
RCCS took a lot of stress off from us, so we could focus on just being and existing and surviving.
With the help of RCCS, we can today save life of children and adults with the newest medications. Without their help, it's impossible.
RCCSY has made it possible for patients like these to get the treatment they need while staying close to the support system they already have.
I look up to the heavens and I say, Father dear, won't you help me? Won't you help me today? So I turn to you.
Funded by the RCCS, the new RCCSY has helped not just these brave fighters, but scores of patients since opening 4 years ago. But many more await our help.
RCCS gave me the backbone and the courage and support to be able to make a full recovery. That itself was a miracle.
I never had an idea how much help you need, how much paperwork, medical decisions, connections. When I was exposed to that, it was shocking. But then it was so nice to know that there's people there that could help you.
זה שקורה לך נס, אבל לפעמים צריך שליח בשביל לעשות את הנס. RCCS הם השליחים של הניסים.
I remember Rabbi Friedis telling me, Rabbi Nissen, don't worry, I saw people. This case, I'm telling you, we'll drink l'chaim together.
And Baruch Hashem, I'm here today to tell the story.
Won't you help me today?
Find out how you can help. Visit rccscancer.org to support our work and partner with us to save lives all over the world.